Hello everyone, welcome to Social Justice Saturday with the Radical Social Worker. So in this video, we're going to be talking about COVID-19 and the social justice issues that have come up surrounding this pandemic. I'm probably going to do the next two Social Justice Saturdays focused on this topic, so I won't hit on all of them in this video today, but I will touch on a few. So before I start, I just want to say I hope that you all are staying healthy and doing your best to follow the recommendations and requirements set forth by your particular cities, states, and at the federal level. I know it's not easy. I know this is very disruptive to everyone in a variety of ways, and to some more than others. Just know that I'm sending positive thoughts your way. I know that probably doesn't mean a whole lot, but if you're, during this time, if you're feeling stuck, if you're starting to maybe struggle with some depression or anxiety, or you're feeling hopeless with all of this that's happening, feel free to reach out to me. I can try to help you connect with some resources that are in your area, or some online resources that may be useful to you. Let's dive in. What I want to focus on in this video today surrounding COVID-19 is access. So I want to talk about three specific areas of access. The first is information, the second is resources and goods, and the third is care. Let's talk about access to information. In this day and age, we have an abundance of information at our fingertips. But sometimes that's not always a good thing. There are a lot of disinformation campaigns out there to try to confuse people. When you are accessing information, do your best to make sure that information is valid and reliable. Don't rely on Facebook. Don't rely on Facebook for your information about COVID-19. There's a lot of groups that have popped up out there, and in some respects those can be good things. They can offer support. Some of the groups that are out there are run and operated by medical professionals who are kind of on the front lines of this pandemic, and so they can share valuable information. But it can be really difficult to distinguish which groups and which forums are legitimate. So it is best to just stick with known, valid, and reliable sources like the CDC, like the National Institute of Health, and like the World Health Organization. And I'll link in the comments of this video links to those websites for you. But the way that access to information becomes a social justice issue is two ways primarily that I want to talk about. So the first is internet. Right? I think it has become abundantly clear, if it wasn't already, internet is not a luxury, it's a necessity. We have people who live in rural areas who have limited internet access. We have people who live in poorer communities that have limited internet access. And some of those ways that they may access internet, like public libraries, are closed now. So that just further limits their access to that way to get information. So internet is a big thing, and the fact that that is where, for the most part, people can access kind of these real-time updates regarding what's going on, is including local and state mandates that are coming down regarding behavior and places that you can go and how you can move about. The fact that a lot of that is happening on the internet can be problematic for some folks who maybe don't have that reliable access that so many of us do. So now, as a society, it's really important that we be reflecting on that issue specifically and start to think about how we can advance access to internet to these places and these people who don't typically have reliable internet access. That way they can have the same chance to access information that other people do. The other way that access to information is a social justice issue is when the population is denied access to accurate and credible and relevant information. And unfortunately, that's exactly what happened. The Trump administration has all but eliminated any type of pandemic or health crisis response within our government. So that's a huge hurdle now. And with that comes information. When you have those entities that exist, they can regularly be generating reports and gathering information that can then be disseminated to the public about these types of things. And if those institutions had still been intact, maybe some of this crisis could have been mitigated or intervened with sooner. What we saw early on is denial from the heads of our government that COVID-19 was in fact a real issue that we needed to be concerned about. It was downplayed. We weren't given the opportunity to have the information and kind of process that and start to adjust ourselves and kind of have a little bit of self-determination in this process. And when medical professionals did come to the forefront and begin to speak with this task force that was formed, even still, President Trump and members of the administration were saying things that countered what the medical professionals were saying. And that has led to a lot of confusion, a lot of mistrust. People don't know what information to trust. And unfortunately, what happens is then people start to turn to unreliable sources of information like Facebook. And that's when things like conspiracy theories start to spread. That's when misinformation about home treatments for the virus starts to spread and people's lives can become endangered. The denial of accurate information about something as serious as this is a huge social justice issue. And it's something that we all need to be thinking about in the future. How can we prevent things like that from happening? What can be put into place to ensure that the proper institutions are robust and functional and ready to serve the public? That way we can have the best chance at getting ahead of something like this in the future. This lack of information, this lack of structure has really put us in a position where people are going to suffer and people are already suffering. So we talked about access to information. So now let's talk about access to goods. So we all saw the run on grocery and supply stores that happened. What has it been? A couple of weeks ago now? I feel like time doesn't make sense anymore. We all saw that happen. And unfortunately, what has resulted from that is that some of the most vulnerable people, some of the people most vulnerable to COVID-19 now don't have access to the things that they need. I know that this is a scary time and many people have had that panic reaction of kind of going into self-preservation overdrive. But I think I would just ask all of you to think about, the collective good of your communities. And yes, your life is important and your family is important, and making sure that you have what you need is wonderful. But what we saw happen from that was a lot of exploitation. We saw things like the man who had over 17,000 bottles of hand sanitizer and was looking to sell them at incredibly inflated prices. We saw people, hoarding supplies. We saw people buying excessive amounts of toilet paper and then selling them at inflated prices. And unfortunately, we saw businesses inflate their prices as well. So we saw a lot of exploitive behavior, unfortunately. And, people who are low income, people who are elderly, they often don't have the extra income laying around to go bulk buy, to stock up on supplies. And so in times like this, it becomes crucial that we have in our minds priorities that are greater than ourselves and our immediate bubble. I just would ask that all of you keep in mind, the general health and well-being of the community at large, and do your part to make sure that people who are vulnerable, the most vulnerable to this virus, also have their needs met. It's time for us to kind of band together as a community and as a country to make sure that people are taken care of. So we saw this exploitive behavior happening, and it really has, I think, shined a light on our vast economic and social disparities that exist in this country. So those are broader discussions now that we need to be having. We need to also be thinking about the shortage of medical supplies now, the shortage of medical goods now, where hospitals and clinics are suffering great hardship because their staff don't have the necessary protective gear to make sure that they stay safe so they can continue doing their jobs to keep our community safe. So that brings broader discussions like the structure of our healthcare system, how readily we can access medical services and supplies that we need, which brings me to my third point for today's video, and that is access to medical care. So unfortunately, just as with access to information and communication, rural communities and poor communities don't have adequate access to healthcare. And let's be honest, most places in the United States don't have adequate access to healthcare. In Texas specifically, where I live, we are basically last in access to healthcare. We have the most uninsured people in our state. Things have not been done within our government here in Texas to tackle those issues. And the same things are echoed in states across the country. We see communities where there are no hospitals, where the nearest hospital is 50 miles away. And if you're sick and if you don't have transportation, or if you have limited access to transportation or limited funds, the likelihood that you're going to make that journey to go to the hospital or go to a clinic is pretty slim. So this brings to light a huge social and economic disparity. And that is that the communities that typically are middle class or wealthier have more clinics, have more hospitals, have more access. Poorer communities don't. And that's oftentimes because medical facilities don't believe they will have the opportunity to make the profit that they will have in wealthier communities. Same thing can be said of businesses, same thing can be said of grocery store chains, all of that. So poorer communities and rural communities, by default, because of our tendency to think towards profit over service, those communities don't have access. So that also means those communities aren't going to have access to testing. And we've seen in media already how celebrities and wealthy people have been able to get tested and have their test turnaround times be very quick. Whereas we have neighborhoods in the state of New York where the infection rate is spreading very rapidly and people aren't able to get tested. And we know that with this virus, you can carry it and transmit it without having any symptoms. So the need to ramp up testing is vital. And unfortunately, we are way behind the curve here in the United States in our ability to test. But there's a lot to unpack here. There are broad implications for so much of what we're seeing happening now that goes beyond the health aspect, the sickness aspect of COVID-19. There are some real deep conversations we need to be having. And when we've recovered from this, or even during the process of recovering from this, we need to be starting to address some of these issues too. Thank you all for watching, and again, I hope that you're staying healthy. I hope you're doing your best to follow the recommendations and practicing physical distancing from each other. I know it's hard, but keep in mind the community around you. Just treat it as if you're already infected and you're working to not transmit it to someone else. That's the goal here, is to stop transmission. That way our medical system, our hospital system doesn't get so overwhelmed that it completely breaks down. And that is a real risk. So we all need to be doing our part. So thank you all for watching, and take care, and I'll see you soon. Bye.